Hello, 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 and welcome back to the Therapist Corner. My name is Alexis Frederick Bowie, and we have the pleasure of having with us today Rachel Wilson. We are so excited to have her a part of our webinar series for the month of May. We are celebrating women, we are celebrating mothers, and we are very excited to talk with Rachel today about antepartum and postpartum and taking care of yourself and supporting your clients. So before we get started, Rachel, just tell us a little bit about yourself.
Hi, everyone. Thank you so much for allowing me to come on and speak on the platform. So, my name is Rachel Wilson. I am a licensed clinical social worker. I work with the pediatric maternity population. I'm really passionate about this field, just from my own experiences and as a Black woman, um, and as someone who had to fight for the things that I needed, and taking my mental health background, and all in all, here we are, working hard to change things, to empower folks, and to create change within the postpartum antepartum world.
Well, thank you. And it is important. It is important. And being someone who has also given birth and who has also faced challenges, um, I definitely love the work that you do. I see the impact that it's making. So let's get into a little bit. We're not going to give people everything. We're going to give them just a little bit. If you want the whole thing, you're going to sign up for this webinar. So, what are some common physical and emotional changes experienced during pregnancy?
Okay, so first thing I want to throw out a disclaimer, right? Um, I think like in this world, right? Motherhood, pregnancy, postpartum, we often get into comparing ourselves to other folks. My pregnancy is not going to look like your pregnancy, and my 5 month bump may look like I'm 9 months, and yours may not. So I also want to normalize, like, these are the things that we're going to talk about are some of the things that folks may face and what they look like. But there is no cookie cutter answer. And a lot of the statistics that are out there are not really reflective of
Mhm.
all ethnic groups. So we want to
Mhm.
keep that in mind. And that's why this work is also really, really important. So some of the common physical changes, right? Like I just mentioned, weight. Um, your first pregnancy, you may not show until later in the pregnancy, but then second and beyond, it's like, whoa, you're 3 months pregnant. Like, whoa, uh, baby, you start to look way bigger than, what you actually are. Breast. Some folks start to experience lactation early on. And if you are not familiar with that, you wake up and you're like, well, wait a minute, why am I wet? What is happening? Even and I don't want to dig too deep into the medical world, but just hormonal changes. A lot of women may start to experience lower sex drive. Maybe they start to pick up on different bacterial infections. And if you're not familiar with those things, they can freak you out, right? Like, what is that? Why is it all of a sudden my drive is zero, right? Or, well, wait a minute, as I progressed in my pregnancy and my blood flow began to increase, now I'm ready to rock and roll. So just some of those things. Vision. I personally experienced vision issues. One day I just couldn't see. I don't know. But all of those things, while they definitely you should speak to your care provider, but some of those things do happen. From top to bottom, anything can change. To be honest, during pregnancy, it can be your rings don't fit anymore. Your feet are swollen. It can be internal and both external. So just make sure that as you travel along the journey, I tell my clients all the time, pull up your notepad, your phone, and start to jot down things so that when you walk into your doctor's office, You're like, this happened, this happened, this happened, this happened. And that's really going to help the folks who are caring for you care for you.
Wow,
Um,
yeah. Oh,
yeah,
yeah,
and
so
then
true.
emotional changes. I will say that pregnancy and motherhood, your brain just it's typically not going to operate the same, and that's a protective factor. It's a protective factor. A lot of women speak about forgetfulness. Um, Especially if you're sleep deprived, you're up all night, if you're breastfeeding, your brain is like, feed baby, change baby, and then you're like, wait, when's the last time I took a shower?
Mm-hmm.
And that's really, like I said, it's a protective factor. It helps us to care for our young child. When you're somewhere, you're in a crowded place and there's 100 people talking, but you can hear your baby,
Yeah.
or your breast begin to leak because you've heard another baby. So there's just so many things that I'm gonna dive a little deeper into during the webinar, but from top to bottom anything can change.
Yeah, so true, so true. I'm soaking that all in because I'm like, yup, 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 yup. Like those hit
Mhm.
so many things. So I know a lot of people are curious and want to know about baby blues versus postpartum depression. So how are they distinguished?
Yes, yes. So, before I answer, I do want to say that, like most mental health terms, they are not used correctly. A lot of folks say, "Oh, you have postpartum. Oh, you have postpartum," and typically they're referring to depression, right?
Mm-hmm.
But in reality, postpartum just means you had a baby and then the time following that.
Mm-hmm.
Okay. That's what the word postpartum means, but sometimes people are using it, in a way to describe depression, and
Mm-hmm.
that's not accurate. So that's the first thing. So baby blues, we're talking about feeling sad, maybe a little depressed. You're trying to figure out your life. I have this baby that maybe won't stop crying. I'm trying to figure out breastfeeding. I just don't feel like myself. And you aren't yourself. You're essentially a new person, right? But when we start to talk about like just not wanting to get up to move, but there's a time frame on that. There's a time frame on that. So once we get past 2 weeks of postpartum, again, that being after you had a baby and you're still feeling low, you're still feeling like you don't have the desire to move, to take care of baby. Take care of yourself. I use that lightly because, like I said, sometimes when you're so focused on taking care of baby, sometimes self-care finds itself on the back burner. But once we pass that 2 week mark, now we're talking about uh does this person meet the criteria for depression? And it's super important because I hear folks say like baby blues and the baby is 6 months, and it's like, no, I think we need to have a higher level conversation. Now we're starting to talk
Mm-hmm.
about depression,
Okay.
whether, are we manic? We have to have those deeper conversations. And the more we talk about these things, the more folks feel empowered. Is my goal to actually say, you know what? No, I don't feel well. Baby is 3 weeks, baby is 4 weeks, and that's why it's super important for pediatricians and our OBs when we come in for those follow up appointments to do thorough exams, not just say how you doing, because most
Right,
of us
yeah.
most of us
Mm-hmm.
say, I'm good, I'm okay. No, but those aren't really the questions that we need to ask. Are you feeling like you're able to take care of baby? Do you feel like you're meeting baby's needs? You know, um, are you having those crying spells? And I always encourage folks, if you feel like you're unable to, the best thing you can do for your baby is to put that baby in a safe place, crib, and make those phone calls, call for help, call your doctor's office, call your nearest psychiatric crisis center, so that you can safely get help and baby is safe as well.
Yeah, that's good. Yeah. And I learned something new because you're right. The word postpartum is just thrown out there, even within the mental health field, um, because there's like a fine line between the mental health and the medical side of things, with like the hormone imbalances, everything trying to come back together.
Mm.
Um, so I definitely have heard it misused. I've probably misused it. Um, so that's good information to know. So to wrap us up, just with the snippet, what would you say for clinicians if they are how can they support clients who are within the antepartum and or postpartum stage of life?
Yes, yes. I think first off, taking, trainings such as the one that I'm going to be providing. Yes, yes, yes. Because, you know, to be completely honest, the worst thing that you can do is to use words that are behavior or language that is going to cause that person to not want to come back. And perinatal mental health is so important. We're not just treating mom, we're treating dad. There's studies out here about postpartum depression and dads. You know,
Mm,
mom is dealing with depression and she can't even get off the couch. So, is she going to be able to truly take care of baby? Or maybe she's having a manic episode. A lot of providers I've seen, maybe this person, was on antipsychotropics, and then, oh, you have a positive pregnancy test, discharge all the meds. And it's like, whoa, 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 wait a minute. We have to think about the pros and the cons. Is every
mm-hmm,
medication safe? No. But if this pregnant mama goes into a manic episode, or if this manic mama, has a suicide attempt, like,
mm-hmm,
we have to weigh the pros and the cons. And
right.
I think unfortunately there's not enough information about this population. And when soon someone's pregnant, it's like, whoa, all right, go see your OB, and the OB
Mm,
can't, do it all. So I think the best thing that folks can do is get education. And if you are not familiar, you got to be honest with yourself. You say, to that client, listen, this is not my best field. Let me connect you to some folks that can help you. Let me connect you to some folks that can, provide you with resources that they can properly, diagnose and treat and support you. The worst thing you could do is sit there and act like you know what's going on, and
mm-hmm,
you don't. We don't want that mom to go home and never seek treatment.
right.
um so yeah, so educate yourself and refer out, please. um
Okay, all right. I know that's right. So thank you, Rachel, for giving us just this sneak peek into the webinar that is happening May 14th at 6 p.m. You can click on the links. You can go to our Instagram. You can go to our Facebook. You can go to rscourses.com. Make sure that you are signed up for this webinar. You don't want to miss it. There is going to be such fruitful information, and we're going to be able to discuss this as clinicians in a space where we're all learning. So, what better way to support your clients than, like Rachel said, getting the education, taking the time to make sure that you know what's going on, and you're getting your CEs and CEUs. So, kill two birds with one stone. Here we are. So, again, we thank you, Rachel, so much, and we cannot wait to see you on the 14th.
yes, thank you so much, guys. See you soon.